Today, we get to talk coronavirus, hopefully.
Corona and a lime.
Corona lime. It's craziness, so this whole coronavirus, and, I know you guys got to see a little bits and pieces of us talking, and we've had some technical issues. Internet down, I don't know, rain, snow, whatever the heck it is, who knows. But I was thinking of this, like, who out there is actually scared and fearful of this virus? Just raise your hands, just comment, just say yes. Just curious, just wondering, what it is that you think. You watch the stinking news, you watch Facebook, you watch Instagram, your feeds, and it's all fear. It's all scaring the crap out of you.
Yep.
I mean, literally, you're not even going to be able to go to the bathroom anymore because of this coronavirus. Hopefully, it doesn't affect you and cause diarrhea.
I mean, for real,
have some issues.
The media is saying it will affect your life. It's not a matter of if, it's a matter of when. I mean, these are the things that they're telling us.
Yep.
And it's not because I watch the news, because I definitely do not do that.
No.
But I see snippets and stuff when I'm browsing the Facebooker. But I mean, it's crazy. They are there's a local college. We just got word that they're closing classes.
Suspending indefinitely just until, I got a letter from this morning. Well, we have Grandparents' Day on Wednesday that they already canceled it. So they canceled it for tomorrow. So, because you're not supposed to have, big masses and gatherings, because there's been 4 cases in Kentucky. So, we got to shut down the whole country for that. And so they shut down that. They've shut down. We said it the other day. Yesterday, it's like, just wait. Schools are going to start shutting down, and then that college shuts down today. And that's just the first of many. They already told our kids, it's like, if you don't want to send your kids to school, I understand. You don't have to.
Yeah.
Basically, keep them home because we don't want to get sick. I would almost say the opposite. We're okay to get sick.
Yeah.
It's okay to express health. It's okay to get that virus so that you can truly build immunity to things, but don't be scared of the media, guys. It's okay to still order on Amazon. Yeah. It's okay to go to a concert or a trip. We were gonna go to Mexico or something in the next few weeks, but we don't have my daughter. She's 6 months. We don't have her birth certificate and passport and everything all set up yet. So it's in the process. So we probably won't be able to go. They're probably gonna shut down air travel anyways.
Put on your carry-on.
I have no problem with it.
Yeah. They got those little bags that carry
She'll be
dogs.
fine. She'll be fine.
No, but today, guys, what we really want to talk about is the toilet paper shortage. That's really what we want to hit on hard. So
yeah, it's crazy. It's toilet paper. It's antibacterial sanitizer.
Yeah, that's another thing. How many of you, because of the coronavirus, started washing your hands?
Yeah, finally.
I mean,
we joke about it. It's not funny, but it's like the whole thing that they're telling you is wash your hands and don't touch your face.
Don't touch your face.
That's it. Why don't they tell you what we're about to tell you? The 5 ways to prevent the coronavirus, the 5 ways to take care of your health, the 5 ways to find out, is your immune system strong or not? Should you be worried or should you not? Because if your immune system is strong, guess what? You don't have to be worried.
Right.
There's nothing to worry about.
It's 100%.
How do you know? How do you test your immune system? Somebody go ahead and start typing that in while we're getting to that point. How do you test your immune system? Yeah. We actually did it yesterday on I think it was take 2. That we had to delete off because we had no sound, but we actually got those markers drawn, and we'll go over those when we get them back. So, 5 ways to prevent coronavirus. It's a huge deal today.
It is.
It's all over the place.
But I mean, at the end of the day, what do we do? What should we be doing? What do we do? Let's not ignore it. I mean, I guess that would be irresponsible just to completely ignore the whole idea.
Side note: if you're looking for $1,100, they got a new vaccine that you could try out. They're taking like 1,000 people.
Really?
And they give you $1,100 for the new coronavirus vaccine. Who would like to be in that test pool?
I'm good.
I think I'm busy on whatever day that is, Yeah. So, but again, it's the importance of having a different, approach and a different aspect and view of what this virus is. The people that it's affecting, older people, 65, 75, 85 and above, and the people that are not just. It doesn't matter that you're aged. Well-aged, man. There's nothing like fine wine.
That's right. That's true.
And so, but the thing is if you're aged and you're immune compromised, well, listen, I don't care if it's the coronavirus or he said it on one of the ones that we had to get off of. What's the next virus going to be?
I would definitely think Heineken.
The Heineken virus, the Heineken COVID-20. So you know,
Heine 20.
There's gonna be another virus. Like every 2 years, there's a new scare, and the toilet paper outages and shortages, and you can't ship things, and it's just a bunch of craziness, you know. So do not fall into all the fear that the media is put. I actually read the other day that the media is actually getting sued right now, because they're shutting down, they're affecting the economy, they're affecting people's livelihoods and whatnot, that they are getting sued because the virus is not the big a deal. Numbers, and I can maybe try to look them up, like the numbers of how many people actually have had this versus like have gotten well versus like the flu, and how many actually just died from the flu.
Right.
It's not even close.
Yep.
But we're throwing this so far out of proportion, guys.
I mean, the travel industry is getting hit
Unbelievable.
hard. Everybody is.
Take care of yourself. And guess when you should take care of yourself? The next outbreak? Today?
Yesterday?
Only because there's an outbreak? Right. No, you should take care of yourself every gosh darn day for the rest of your life.
Well, and that's why we don't walk around in fear. You know, because we walk our talk. You know, we're doing everything we tell you guys to do, and so, and we know our immune system's functioning optimally, and we're going to confirm it with a test we did yesterday that we're going to talk about.
Which nobody said that. Come on, which one? What is that test? Throw me out some stuff there.
Yep.
What
so,
is the test?
And guys, listen. You want to get good health advice when it comes to any kind of condition that you're trying to deal with, just overall health. And, you know, we're not going to give you information today that's, that's designed like, this herb, you can't hear anything? We're not going to give you information today that's.
So can you hear us? Give us a thumbs up if you can hear us. Like I said, we've been having some technical difficulties, but we'll keep going because I can kind of hear it right here.
But yeah, guys, so I saw a post to a friend of mine. She's in the medical world. She's a nurse practitioner, and the post said, stop taking the natural advice and doing things like elderberry, echinacea, vitamin D, and all that crap. She said you need to go to your medical doctor immediately and get real medical advice. And so whether your medical doctor is telling you this, your pediatrician, you know, whoever's telling you this, again, what is that going to do? What does that look like? Because in reality, and you told me this,
Yep.
they're telling you don't go to the doctor.
Stay away from the doctors. Don't go to the doctors if you feel like you're sick, if you have a fever, if you've got coughing or sneezing or whatever it is. Stay away from the doctors. That's the medical advice they're giving you. Now, they say if it's over 103 or 104, whatever, like you can come in. If you're past this age or under this age, like it's okay to come in. But they're telling you to stay away from it. Yep. You want that medical advice? Well, actually, I think that's not bad medical advice. Some of the better medical advice I've heard in a long time. So.
Well, guys, you really can't do much with the virus. And the antiviral drugs out there, like Tamiflu, the antiviral drugs, they're only trying to mimic what the body does supposed to do on its own. And again, we're going to give you some things to make sure your immune system is functioning optimally. Because if you have a good functioning immune system, there is no concern over this virus. There just isn't. And so, again, I don't care if you're 80 years old or if you're 2 years old. If you have a good functioning immune system, then you have nothing to worry about.
And I don't think we talk about it too much in like one of these 5 things, but like you can't just go. We had somebody come in today. They like want to get healthy, but they're sick, and you know their stomach is a wreck, and they're trying to lose weight and all these things. And what did they come in eating? McDonald's.
She tried to throw it away in the front.
She was trying to throw it away in the front, but I was like coming into that time, and she got caught red-handed. He's like, "You're eating McDonald's?" I saw somebody post the other day, like the kids are gonna go eat some Mexican food. Yet, well, like it's better than Burger King. So you go to Burger King often? Like you cannot go do that stuff. Eating on the go is not that hard. I said this, I don't remember what time and if it actually went and got live or not, but an apple is on the go.
Yep.
A banana is on the go.
Yep.
You can stop at a Kroger and run in and get some fruit or some cut up fruit or some vegetables and like some hummus or some dip in the same amount of time it took you to wait in that long gosh darn line at McDonald's or the healthy fast food restaurant. What's the healthy fast food restaurant? I love it. Because there is no healthy fast food restaurant. But what is it called?
Chipotle.
The chicken.
Oh, Chick-fil-A.
Chick-fil-A.
It's God's food.
It's God's food. Yeah, they close on Sundays, right? Yeah, man.
All right. Come on.
Somebody got it.
We go-
CD4, CD8.
Yep.
So,
Nice. There you go, guys.
Who is that? Lori. Yeah. So that's what we got tested yesterday. We got it drawn. Like I said, we got it drawn when we were doing it live. You couldn't hear us. Not that you need to hear me to get my blood drawn. But CD4, CD8 ratio.
Yep.
Very, very important.
Guys, and if you look this up, you're going to see it's a test only done in the medical world for HIV patients. But again, why? Well, because HIV affects what? It affects your immune system. And so these markers, the ratio between these markers, because they're looking at immune cells, can tell you how well that your immune system is functioning. And so T cells, killer T cells, these are cells that go and eat the virus. Again, our body's designed to fight viruses. Now, ideally, our immune system's able to get these viruses before they actually get into the cell. Because understand, guys, virus is just a protein that's looking for a host so that it can survive, because it can't survive outside of a host. And so it wants to get inside of us, and then once it gets inside, it wants to get into our cells. But again, there's a lot of immune reaction that's supposed to take place that doesn't even allow it to get intracellular. And again, these are innate responses. These are things that you're born with. Your body's designed to do this. Unfortunately, we do a lot of things like, let me give you an example. Your tonsils, your adenoids, these are part of your immune system that is supposed to get foreign invaders, whether it's bacteria, viruses, or whatever, before they can actually get inside of you. And that's why they're located at the opening of your body, your mouth. And so for the many of you that had those ripped out by your pediatrician, you don't have that bodyguard or that bouncer at the front doors. And so again, even more important, for these situations, you want to make sure that your immune system is functioning as best as possible, because when you remove parts of your immune system, it's not a good thing, guys. It's not a good thing, and it hinders the normal function of that system. Yep. All right, so.
And the thing about going to the doctor for a virus, what are you going to go get, an antibiotic?
Exactly.
Or what are you going to go get, an antiviral? So you're going to go get some Tamiflu. We talked about this a couple weeks ago. What's one of the side effects of Tamiflu? You got your 3-year-old, your 2-year-old, your 5-year-old is sick with the flu, and it's going to last a couple days, maybe a couple weeks at worst. Give them Tamiflu to try to get them better in 24 hours, yet one of the side effects is they're going to kill themselves. One of the common side effects is they're going to kill themselves.
It's not a joke.
It's not a joke, but you don't even know that. You had no idea that was a side effect until I just said it. It's unbelievable to me. It makes no sense that you should just be supporting your kids. You're supporting their immune system. So yes.
Well, we had a patient just in the other day. She said, me, my 2 kids, we all have this crazy restless leg that just randomly came on. Uh-huh. I was like, really? Well, what have you changed? She's like, well, I mean, we all got the flu. I'm like, okay. Well, did you do anything about the flu? Well, we're all on Tamiflu. I said, honey, I bet you that's exactly what's causing it.
Is there anything that's changed?
How could it cause it? I said, I don't know, but it's not a coincidence, right? It's not a coincidence.
Yep.
All right, so we want to make sure immune system is functioning well. What you got?
Well, somebody said, let's see here. Just say hi to some people. Jade is in Colorado.
Nice.
And Jade says that they just declared a state of emergency in Colorado. We got the state of emergency called. We had 1 case in Kentucky.
Yep.
And then it was and then there was 2 or maybe 3 cases, and it was a state of emergency. I think we're at 6 right now. Yeah. And like I said, colleges are already shutting down. Things are getting crazy, and it's
Kentucky's behind on a lot of things, yeah, but disease and sickness,
we
are not behind on that. So, unfortunately,
get your CD4, CD8 ratios checked ASAP right now as soon as possible. What's the one reason why they couldn't go get that checked?
Contraindication to getting this checked.
Yeah.
Vaccination, a recent vaccination.
Recent vaccination.
And why is that? Because it is going to throw your immune system for a loop. Big time. It's just going to throw off these markers. They know it will throw off these markers. So is it okay that they're being thrown off by a vaccine versus by some other issue? No. It's still jacking your immune system up, guys. Yep. Why? Well, because there's all kinds of toxic stuff in those vaccines. That's the easy answer.
Mercury, aluminum, formaldehyde. And then, you talk about eggs and other things that people are allergic to. But you just put those neurotoxins, known neurotoxins, into your body. And guess what? Those 1,000 people that they're looking to pay $1,100 to do this coronavirus vaccine trial, it's going to be sold out, and it's probably already sold out.
It's crazy.
And those people are going to get sick from it. So
Crazy.
get your CD4, CD8, get your immune system tested, get it done as soon as possible.
Yep.
You
Now
get that done anywhere, pretty much, really. Like,
Yep.
any cash lab.
Right, absolutely. And guys, we're gonna, so let's dive into some things that we can do to, again, support immune system. The whole thing about boosting immune system function, we've heard it before. Chiropractors will tell you, and a lot of chiros don't like when I go out and say this. But
I saw 5 or 6 today saying this.
Yep.
Yeah.
But they'll say that a chiropractic adjustment is going to boost your immune system up to 200%. That's
exactly what it was.
So, guys, again, I mean, I don't think because we adjust each other probably at least once a week. I didn't hear I have the coronavirus. I need to hurry up and get adjusted so that my immune system gets boosted. That didn't run through my mind. Now, do I make sure that I don't have subluxation in my spine so my central nervous system can function optimally? Oh, absolutely. Now, if a subluxation is affecting immune system function and you remove that subluxation, can it improve immune system function? I would agree to that too.
Yep.
But the whole idea behind an adjustment, boosting your immune system 200%, guys, I mean, I'm going to get adjusted 5 times a day.
Yeah.
So I'm going to have a
1,000%
1,000% boost, right?
But, it can help your immune system, so there's no denying that. But if your main cause of the reason why your immune system is compromised
Right.
is due to a subluxation,
Right.
that's just not everybody.
You can't consume a ton of sugar one day and then the next day get adjusted and think, oh, it's going to boost my immune system. It just doesn't work like that.
Susie wants to know if it can, I'm assuming you say, can we do the CD4, CD8? And the answer is yes, we can.
Yeah,
they said we did that yesterday. It's just a quick, simple blood draw.
It's easy. And it's under $100, guys.
Yeah.
It's under $100 for that test.
Yep.
All right, what are some herbs that have been proven? Now, again, guys, this is not our opinion. There's research, medical research. If you go to PubMed, that's where I like to get a lot of my research because it's medical research. And there's a ton of research showing that, we're big on elderberry too. I didn't put it in here.
Yeah, because elderberry can actually strip viruses, right? So like elderberry is very powerful, and we talked about the other day, but like elderberry is like a good October to March type of a supplement during the flu seasons. But obviously, I think it's going to extend a little bit more in 2020, and there's nothing wrong with that. So
and quality, obviously, you want to make sure you're getting good organic, good quality stuff. But echinacea and astragalus, guys, there's so much research showing how much this can just keep that immune system strong. And again, it's a lot of that, the cell-mediated response. So before these viruses actually get into the cell, because that's when it starts to attack the host, is once it's already in your cells. So if your body can react before it gets into the cells and kill off that virus, most likely you're not even symptomatic at all, right? And so these herbs have been known to just increase immune activity, increase immune cells. So there are certain times, you don't want to do these type of herbs. But again, we don't blanket statement any herbs. I mean, there should be certain testing done, but there's been a lot shown that this can improve.
yeah, and it's not just take echinacea and astragalus so that you don't get the flu.
Right.
Or the coronavirus.
Right.
Right? Like, it's not like that. You got to figure out where your immune system is compromised. Astragalus is one of the most amazing herbs. I took mine already this morning. It can stimulate like stem cell production in your body.
Oh, it's amazing.
Like, as you age, you lose stem cells. You just don't produce them anymore. That's why you get gray hair. And I don't know who gets gray hair, but some people do.
It makes everything longer.
It does.
Your neurons,
it all. So,
hair.
and so that's why you don't heal like you did when you were 20, when you're 60. It's just you don't have enough. You don't have the stem cells to be able to do that anymore. Well, astragalus can actually like stimulate the growth and production of more stem cells. It's anti-aging. It helps support your immune system. It is just great on all aspects, and it's a thing that we do pretty regularly.
What do you think about doing like an infusion of your kid's blood?
Yeah, like that would be amazing if you could do that.
Right?
Like, literally, it would be amazing. We lose these peptides in our body as we get older, and we just don't produce them. Again, the whole thing of why we don't heal like we did when we were younger. And so you can actually hook it up to a younger person in your blood, and those peptides will go and take over your cells and like actually like make you younger, stronger, and healthier. Now that is not something they do here in America, and I don't know where they do.
The fountain of life is in your children.
That's it. But there's peptides that you can do that you can inject that have similar effects on that as well. So it's echinacea and it's astragalus.
Astragalus has been known for upper respiratory stuff, guys. And again, this type of virus is supposed to cause more upper respiratory type of issues. And so that's some things that you could do. Again, you want to make sure you get a good quality. We use both of these herbs in a liquid herb, and they're phenomenal phenomenal. They taste terrible.
And terrible taste.
And they're phenomenal.
Yes.
How about your vitamin D?
Yeah. So you go get once a year, you get tested. Somebody asked like the other day, like how often do you get it tested? What should numbers and stuff be? You understand, like when you go get your physical done and you get a CBC or a CMP done once a year. Vitamin D is not something that's just thrown in there. You have to add that on. So not everybody gets their vitamin D tested because most people are normal.
Normal.
According to the medical normal.
Right.
If you're normal medically, you're 20, maybe 30, nanograms per mole. You need to be like 80 to 100. And just being in that zone, you are able to literally fight, reverse, and kill off like 17 different cancers.
In
it's
the zone.
amazing. But you have to you have to get outside.
Yep.
But guess what? There's no sunshine outside.
Right.
And being fully dressed is also probably not. I mean, you have to get out in like 70% skin exposure.
Birthday suit.
Birthday suit. That's the best way to do it.
I mean, we can get in your Speedo again.
I need to. Maybe we'll go live like that one day.
Yeah, that'd be good.
See if the numbers jump.
But yeah, guys, you got to, I mean, at the end of the day, you got to be supplementing, in my opinion. It's really hard to get vitamin D levels up to where they need to be.
Yep.
But again, there's been a lot of research that shows that vitamin D will really, really help with normalized immune function. Okay, so make sure your vitamin D levels are good.
And you got to get it tested. It's a low dollar check to get it done. And do it. And then, because then the next question is always like, well, how much D do you take? It's like, well, what is your levels? If your levels are nothing, take it a lot.
What type are you taking?
And then you have to, like, well, what does your gut look like? Do you have stomach acid to break it down to help to absorb that stuff? So there's a lot of questions going in. Again, like we're just like we're giving you the information. Go back and you can look at earlier shows to find out some stuff there.
You got it.
Yes, Susie, we do have astragalus in the office for sale.
Yep.
Yes,
we sure do. All right, guys, this is the easiest thing you can do. Well, it may be easier for some people, but you can't put inflammatory foods in your body and expect your body to function normally. Would you ever put gasoline in a diesel engine? And I hope the answer is no.
Yeah.
But like the gal earlier, she walks in with a Coke in her hand. She just dropped who knows what she ate at McDonald's. She's putting stuff in her body. Her body is not designed to run on. Yep. It causes inflammation. It causes dysfunction. It leads to disease. It leads to an immune system that's a mess. It sounds still bad.
I don't know. She said sound stop, but we're going to keep going, and I'm going to just check on that. So you go ahead and keep going on that thought there.
Yeah, if sound stopped again, I'm pretty convinced that. Oh no, we're still going.
I think we're good.
Okay. But yeah, guys. So some things you can do. So a lot of you guys are already eating some vegetables and some fruit. Switch. Make sure you're doing organic. You're not putting the herbicides and pesticides and all that junk in your diet. Stop doing the regular commercialized meats. Do the grass-fed, grass-finished, free-range type of meats. And then obviously, guys, we've got to stop the sweets, the sugar, the pops, these Gatorades and Powerades and anything in a box or a bag, all of this junk that you're putting in your body. Again, I mean, a chemical is a foreign invader. A dye is a foreign invader. An abnormal, an artificial sweetener, it's a foreign invader going in your body. So your immune system reacts to all this stuff. So then when it comes time for it to need to fight a virus, it's like, phew, I'm done.
Well, let's do this. Which again, I have a weird feeling that they're going to start canceling this stuff. Baseball, little leagues, soccers and stuff, those things are coming up.
Yep.
Again, are they going to actually let them go, or is it going to be canceled for a couple weeks? I feel like spring break this year is going to be like 4 weeks long, and so just
the month of April.
Look out for that. But you got sports games. So now you got school, you got work, you got school. You got to pick up the kids. You got to get them ready. You got to get them to the game, and then it's late. What do you do for food? Well, you already lost because you should have been prepared. You should have had an ice chest already made with some sandwiches with some good healthy multi-grain, good, healthy sprouted grain type breads, or some lettuce wraps, or some soups, or some whatever it is. Like you should have been prepared. You should have had fruit for your kids so you didn't have to eat the Twinkie after the game. Parents don't like when we have to bring snacks.
Right. Your snack's boring.
Water? Like you got the kids water? Like, where's the Capri Suns? Where's the Gatorades?
Yep.
Like, well, guys, we just don't do that stuff because it's not congruent with this. It's not congruent. Are there things that you can do like Numas and coconut waters and things that like act as your Gatorade that doesn't cause like the inflammation and cancers and heart. Absolutely, there's all kinds of stuff. And if you want to learn more about that, reach out to us because we can really help with that. And maybe we'll do a show on that one day if there's enough interest of just like healthy
replaces
things.
your water though.
Nothing replaces water. Good grief, got to drink water. But be prepared. Be prepared when you go to these events. Be prepared when you're traveling, when you're getting on the road. Because you go drive 8 hours, what are you going to do? Well, I'm going to stop and eat at some fast food place. No. Stop at the grocery store. There's a Whole Foods on the way somewhere. Yep. Stop somewhere that is going to be healthy for you. Make gooder decisions all the good time.
Absolutely.
So,
got to do it. Got to do it. And just
that.
think about it, guys. If 80% of your immune cells are in your gut, and you're doing things every day to ruin your gut, your immune system.
I don't do it every day.
Doesn't
I do
have
it
a chance.
3 to 4 days a week.
Yep. It's
the same thing.
So we hear a lot. It's bad stuff.
Again, and I said this the other day, but do you know what the half-life of those fried oils in like a French fry from McDonald's is? A half-life meaning that's half the time. Yeah, exactly. Like a couple weeks, couple hours. Like because I ate it and it went right through me.
I pooped it out. So, yeah, it's gone.
Guys, that stuff will cause like nerve issues and cause pain and cause dysfunction and gut issues for like 100 and 120
it's like
days.
6 months. Yeah, it's crazy.
It's unbelievable, and you think it's just that one time. No. That stuff will kill you, will clog you, will cause issues, will cause inflammation. Stay away from it.
Yep, 100%. All right, guys, so everybody's jumping in on the Clorox wipes and the Lysol and all that stuff.
Yep.
Guys, that's toxic. Chemicals in that. You touch your hand on one of those wipes, stuff's going in your body. It's ruining your system. It's ruining your immune system. But, guys, we understand. You got people out there that they just feel like they need to clean every surface and keep everything immaculate and sterile and blah, blah, blah. Fine.
Somebody walks by, you're just spraying them, just spraying right after them. Like
following them around the office. But, no, guys, things like apple cider vinegar. Yep. You could dilute apple cider vinegar with water in a spray bottle, spray it all over your surfaces, everything. Yeah, whatever. Countertops, everything. And the acidity will kill viruses and bacteria big time. And then silver, colloidal silver. A lot about colloidal silver, yeah?
Man, colloidal silver is just amazing. We have like nasal sprays to help get up in the nasals because you think about mold, you think about viruses, you think about bacteria and things like where do they come? Where you're going to breathe them. You're going to breathe them in, so you're here. So if we can get something to kind of kill things in there, that's antibacterial, antiviral, antimicrobial, awesome, great stuff. We also will do the colloidal silver in a nebulizer rather than doing the steroids or rather than doing like the antibiotics to get it up there, get it in the lungs. People are scared of pneumonias. People are scared of things. Man, I'm telling you, the colloidal silver is just absolutely amazing.
Awesome.
It's some of the best stuff that you could take, some of the best stuff that you can clean with. It'll just disinfect everything. It's just amazing. If you don't know anything about colloidal silver, start looking at it and get good quality of stuff. So
yeah, and stop looking at all the reviews and all these comments saying that it's going to turn you blue and it's terrible for you. It's going to kill your gut and immune system. Guys, get a good source. Questions about it, dosing, things like that, ask us. If you have a good, true colloidal silver, it's not a how the hell do you say that?
Nanoized? They don't know, so we're good.
Nano silver. That's the kind that you can make at home, and that you can turn blue if you drink enough of that stuff.
Sure.
And that stuff long term can really be detrimental to your good flora. Colloidal silver is what you want to be using. Wellness Way has a fantastic one. But yeah. Stuff's awesome.
And one thing specifically about the apple cider vinegar is it's acidic and it helps with stomach acid when ingested. We talked a little bit about that earlier. And he mentioned that a virus is a protein. Well, what does stomach acid digest? Proteins. So guess what you need more of? You need more acid. You need more acid on your skin. You need more acid on your body. You need more acid ingested into your stomach. And that will help and fix acid reflux, GERD, or kill and help you break down proteins, which is also foods or food allergies, right? So yeah, acidity is amazing. Judy says gooder is not a word, and I say too bad. I think it is.
That's one of those words,
And it's not going away.
And we just let that one go.
Alicia, go ahead. Ask whatever you were going to say there. So good. All right.
So guys, at the end of the day, we shouldn't be living in fear. If you're not doing anything good every day and you're eating like crap and not drinking water and drinking a bunch of booze and smoking cigarettes and, if you're not taking care of yourself, I'd be quarantining myself because a flu virus could kill you. Who's dying from flu viruses? Yep. People that are already sick. Who's dying from, from the coronavirus? People that are already sick. No healthy individual will be killed from these viruses. That is my opinion. I just don't think from what we've read about it, from what they're saying about it, healthy individual has absolutely nothing to worry about. Remember 2005? The bird flu. 2009, swine flu. 16, Zika. And now it's corona.
Yeah, and again, what's it going to be tomorrow? There's
Heine.
always something new.
It's the Heine 19.
The media is never going away. And, I was talking to somebody about it the other day, because I don't really remember, the swine flus and the bird flus and stuff, the Zika's, I was stuck in school or doing stuff or whatever, Was it as bad as it is today with, the fear and stuff? And they said, well, I don't think it was. But I said, but the difference between 2009 and 2020, you're saying, is media. Like social media and the platforms that everyone has to share everything on, and people just live in fear, and people love to live in fear. It's just crazy. Don't do that. Stay away from that. Look somewhere different. Check out some of these other wellness way docs. Look what some of the things that Dr. Patrick has shared, because there's just amazing stuff. But it's truth.
It's truth, guys. Because if you watch CNN, MSNBC, and Fox News, you're gonna get different opinions about the same virus. Who's to know what's what? Who's saying the truth? At the end of the day, guys, it's a virus. Your body can handle it. Just do what we say and stay healthy.
Alicia says, will that help you at least till thyroid and all is taken care of? I'm wondering if you're talking about the colloidal silver, because that's when I think you asked that. That's a really hard question to answer without knowing what a test says.
Right.
Is your thyroid issue because of it's an immune system issue and the silver can help kill off whatever it is to help support? Maybe. That's a very difficult question. That would be a consult question.
But at the end of the day, regardless of what you're dealing with, whether it's hypothyroidism, IBS, cancer, if you do the things we said, it's going to be a positive effect on your body,
regardless of what you're dealing with.
So the vitamin D is going to be good for you. Doing some silver, doing some eating good, the echinacea. All of these things for you, and it's going to benefit you.
Yeah.
Getting your thyroid functioning
good,
better obviously is important.
Going to help.
Yeah.
Drinking water is going to help.
Yep.
Not drinking sodas and pops and sweet teas. Kentucky people don't even know there's something called regular tea. I come to learn that one, so.
Yep, you can't switch from Coke to sweet tea. It's not a good switch. But guys, what I want to do, I think, there's so much out there about the immune system. We're talking about some basic things.
Yep.
Maybe we'll get into a little more detail about actual immune function and the difference between the immune activity you're born with versus how you build a good, strong immune system, and why we love our kids playing in the dirt. And, we don't mind our kids around sick kids, and, because there's a way that your body builds immunity. There's a way your body builds strength as far as immune activity. So maybe we can dive more into that.
Yeah. Awesome. Make sure you ask questions. Make sure you share this around. Tag somebody who needs to know this. Somebody who is scared to death of drinking a Corona. No, of getting Corona. Because they don't need to be. As long as you know the truth and take care of your body, you shouldn't be scared at all. So thank you guys as always, and stay tuned for more awesome information.